Hello everybody, and welcome to the Treating Challenging Behavior course. The content of these slides was compiled by myself, Dr. Leslie Neely, and Dr. Catherine Hoffman. This work was supported in whole or part by a grant from the Texas Higher Education Coordinating Board, the THECB. The opinions and conclusions expressed in this document are those of the authors and do not necessarily represent the opinions or policy of the THECB. So we are going to talk about treating challenging behavior with ABA. ABA is also known as Applied Behavior Analysis. ABA is technically defined as the science of systematically applying interventions based on the principles of behavior to improve socially significant behaviors. As behavior analysts, we focus on modifying the environment to help individuals be successful in daily life. We also rely on evidence-based interventions and take data on the progression of those behaviors so we know that the interventions are working. A very important element of ABA includes the ABCs of ABA. The ABCs refer to terms used to describe one behavioral interaction. The antecedent, or what happens before the behavior, is the A term. The behavior, or what the learner does, is the B term. And the consequence, or what happens after a behavior, is the C term. We behavior analysts find that what happens right before and after a behavior can change whether the behavior happens at all. The ABCs also guide us when we look to intervene for a certain behavior. In particular, the consequence can either encourage the behavior to happen again in the future, or reinforce the behavior, or it can discourage the behavior from happening again, or punish the behavior. Please note that we don't talk about reinforcing or punishing an individual, but a behavior itself. Also, consequences don't always mean something bad. For example, if a child sees his mom for the first time in a week, which would be the antecedent, he might hug his mama and tell her that he missed her, which would be the behavior. She might then return the hug and give him a kiss, which would be the consequence of his behaviors. If he hugs and kisses his mom more in the future, we would say that that child's hugging behavior has been reinforced by the mom's consequences, or the hugs that she provided. So one of the best things about ABA is that it allows us to focus all of our attention and efforts on the behaviors we want to see, and minimize our attention and efforts to the interfering behaviors. This is called a reinforcement-based approach. We want to reinforce or encourage appropriate behaviors and minimize attention and efforts to all of the rest of the behaviors. So to get started in ABA, we must first identify the behavior we want to work on. All of you indicated that you are interested in working on decreasing challenging behavior and increasing appropriate behaviors. Before we begin talking about an intervention we can implement, we need to identify and define the challenging behavior that is most crucial to target. So challenging behavior is any behavior that interferes with your child's ability to learn and function within a specific environment. Your child engages in these behaviors for a reason. It could be to communicate a need in order to get something or avoid something. They may not know how to communicate, or their way of communicating may be easier. Your child may also not have the language to ask for what they want. So now I want you to pause for just a minute and write down challenging behaviors you would like to work on with your child. When you meet with your BCBAD, they can help you prioritize these goals and choose the most crucial goal to begin working on first. So what should you expect during your meetings? During your first meeting, your BCBA will want to identify one behavior and define it so that it is observable or able to be seen, and measurable or able to be counted. So here are two examples of defining behavior in observable and measurable terms. So you can see the first one, instead of saying he is paying attention, an observable behavior might be he is sitting with his eyes oriented towards the reader. In addition, instead of saying she is having a tantrum, you could say she is flopping on the floor and crying. So your BCBA will want to define the behavior so that they can take data and make sure the intervention is working. Data can also be helpful in identifying when to make changes to an intervention or program. It has also been shown that if decisions are made based on impressions of progress and not hard data, we tend to overestimate the ability of our child. We have also seen that taken data typically helps students or children make greater gains. So how might you prepare for the meeting? After identifying your behavior, go ahead and observe your child in the natural situation where the challenging behavior occurs. Record your child's responses, i.e., what did they say, what did they do, and how did others respond to them. If you have notes about what happened right before the behavior, please include those. Preferably, if you could take a video of your child's behavior, the video will help your BCBAD get to know your child and help them to design the assessment and intervention that targets your child's current skills. So why does challenging behavior happen? Why do kids do the stuff that they aren't supposed to? The simple answer is to communicate a need. Children use behavior to get good stuff and avoid bad stuff. Kids may not know how to communicate their needs, or their way of communicating may be easier or more successful for them. Kids with autism in particular may not have the language to ask for what they want, or the social skills to ask for what they want appropriately. So let's look at some examples using the ABCs of ABA. This first example is of avoiding bad stuff. So Jacob hates baths. His parents say time to take a bath. Jacob cries and throws himself on the floor. Jacob's parent went to avoid Jacob crying for too long and hurting himself by throwing himself on the floor, so Jacob gets to avoid the bath for 5 more minutes. So how is this like language or communication? Well, Jacob is basically saying, can I have 5 more minutes? By crying and throwing himself on the floor. He wants to avoid bath time, and his challenging behavior successfully gets him an extra 5 minutes. So here's an example of getting good stuff. Jenny is playing with her favorite toy. Her parents say, okay, it's time to put the toy away. Jenny starts whining, creating a continually high-pitched nasal sound. Her parents let Jenny have the toy a little bit longer. So how is this like Jenny using language or communication? Well, this Jenny's whining is essentially communicate, I don't want to put my toy away. Can I play a little bit longer? Right now, Jenny's whining behavior gets her extra time with her toy. Oftentimes, there are multiple reasons why a child might engage in challenging behavior. This is an example of getting good stuff and avoiding bad stuff. Johnny is playing outside. His parents say, time to come inside and clean your room. Johnny runs away. Johnny gets to play outside a little longer and doesn't have to clean his room. So essentially, Johnny's using his running away to communicate, I want to keep playing and I don't want to clean my room. He knows this is a successful way to communicate this, even if his challenging behavior is seen as inappropriate. So how do we figure out what a child is trying to communicate? So behavior analysts identify that most behaviors can be classified by 4 functions or reasons why they occur. The intervention that you will discuss with your BCBAD will be formed based on the function of your child's challenging behavior as identified by an assessment. The first function is called the tangible function, and this simply means that they do the behavior to get access to preferred items or activities. The second function is the escape function. This means they do their challenging behavior to escape from things that they find unpleasant, such as demands, requests, chores, or to terminate something unpleasant, such as homework. The third function is attention. and this is to access attention from others, either words, eye contacts, physical touch, or sometimes even reprimands. The last function is the automatic function. This function includes the process or product of the behavior itself is reinforcing, meaning the child does the behavior because the behavior itself is reinforcing. And most STEM behaviors end up being classified as automatically maintained behaviors. So if your child's behavior is maintained by access to tangibles or preferred items, he or she may exhibit challenging behaviors when trying to access an item or activity that has been denied or interrupted. When the behavior is maintained by escape, your child may engage in the behavior to following a demand or to stop something unpleasant, like a loud noise. For attention-maintained behavior, the behavior may occur when caretakers are busy or attending to another person or child. Finally, if the behavior is automatically maintained, your child may engage in this behavior when they are not engaged with anything else or when they are alone. We will now discuss some basic information you will need to know for the first meeting. These next slides are for informational purposes only, but please feel free to jot down notes or questions to ask your BCBAD. The first thing you and your BCBAD will do is an assessment to identify the function or the reason why your child engages in the behavior. So there are multiple assessments that can be implemented to get a better idea of what the function of the behavior is. Behavioral assessments include conducting interviews or observing the behavior. Indirect assessments are typically in the form of an interview or questionnaire and are usually given to caregivers to seek information about environmental events surrounding the behavior. Direct assessments are based on data collected through direct observation of the behavior. Ultimately, your BCBAD will design the assessment that best meets the needs of you and your family. So after conducting the assessment, you will have a function of behavior. And your BCBAD will then design the intervention based on your assessment results. Our ultimate goal is to decrease the inappropriate challenging behavior and increase the appropriate behaviors. In order to do this, we will not only have to focus on identifying the function of your child's behavior, we have to focus on teaching appropriate skills and/or communication skills. So I want to talk about a couple of forms of communication, or what we call modes of communication, because your child may or may not have the typical form of communication, which is vocal speech. So there are many modes of communication. If your child is non-vocal, your BCBAD will review some of these options. You may consider manual sign or American Sign Language. You might consider an assistive device that will generate the speech for your child, such as speech-generating devices. You might also consider something called the Picture Exchange Communication System, or PECS. PECS involves exchanging a picture with a communication partner in exchange for an item or activity. You can also use PECS for other communication, such as answering questions or labeling items. So through the meetings with your BCBAD, we will develop an intervention to both teach a new skill and reinforce that skill. The intervention we're going to discuss right now is something called functional communication training. Functional communication training is the most commonly used intervention for challenging behavior. However, note that your particular intervention may be different, but will consist of some of the same elements, including choosing an appropriate replacement behavior and designing the intervention to both prompt or teach the appropriate behavior and reinforce the appropriate behavior. So I will now provide a quick overview of functional communication training, as this will provide some of the foundational knowledge for how best to treat challenging behavior. So functional communication training, or FCT, is an intervention to reduce challenging behavior that requires 3 components. The first is the assessment to identify the function of the behavior. The second focuses on teaching an alternative behavior in the form of a communication response. This communication response should achieve the same outcome as the challenging behavior previously did. The third element is responding to the challenging behavior so that it no longer works to achieve the previous outcome, and responding to the appropriate behavior, the appropriate communication response, in a way that it achieves the outcome that the challenging behavior previously did. So how might you incorporate FCT into the function of behavior? So here are some examples. For tangibly maintained behavior, or access to a preferred item or activity, you might block your child's access to the item, and if they communicate with the specific mode of communication most appropriate, they would receive the item. If they use challenging behavior, they would not receive the item. If they are in a situation such as homework, and they typically use challenging behavior to escape that situation. If they use communication, you would allow access to a break, or you would remove the unpleasant situation. However, if they use challenging behavior, you would keep the demands in place, or you would keep the unpleasant situation consistent. The third, attention. Again, if they use the appropriate communication, you would give the attention. However, if they do not use the appropriate communication, they instead use the challenging behavior, you would ignore the behavior. So how do we teach the appropriate behavior? So the first thing I want to talk about is contriving motivation for your child. Sometimes it's hard to provide motivation for your child to increase their appropriate behaviors. So here are some tips for capturing motivation and setting up an opportunity for them to use the appropriate behavior. But for tangibly maintained behavior, or behaviors that are maintained by access to preferred items or routines, you might use a routine that your child knows and interrupt the routine, or you might interrupt the high preferred items or activities by either placing them inside or out of reach, or taking a piece of the preferred item, or turning the preferred item off. For attention, you could contrive a situation by pretending to be on the phone or working. And for escape, you could place a difficult demand or tell your child to do something you know that is not preferred. So contriving the situation would occur in the antecedent condition. So going back to the ABCs of ABA, once you have contrived the situation, you have established the antecedent condition, or what happens before the behavior. However, your child will be used to using the inappropriate behavior to get access to what they want, or to avoid doing what they don't want. Therefore, you might need to use something called prompting to teach the appropriate behavior. A prompt is any hint or cue added to the environment to make it more likely that the learner will respond correctly. A prompt is given after the antecedent occurs and before the behavior occurs. So there are many different types of prompting used in FCT. And it's going to depend on what type of communication modality your child is using. So for example, if your child is using vocal speech, you may need to get a full prompt of movie when he or she asks to watch a movie. You could also use a partial prompt, which would involve saying part of the word, or you could use no prompt and instead perhaps just time delay until your child says the word movie. Manual sign, a full prompt would be signing the entire sign for movie. A partial prompt would be signing, doing the model of the movie sign, and then telling your child to do this, and when they imitate, providing access to the movie. And then no prompt is where you just use a time delay after your child has reached for the movie, wait for them to sign, and then give it to them. And if you're using a card touch or a voice output device, the full prompt might be actually guiding your child's hand to the movie card or the voice output device. A partial prompt might be just touching the card, pointing to it. And a no prompt would, of course, be your child communicating independently by touching the card or device. So prompting can help us to teach or cue our child, But what we do after the behavior or the consequence is very important. We want to be sure to reinforce the appropriate behavior so our child will continue to use the behavior in the future and minimize our attention to the inappropriate behavior. So you will be incorporating reinforcement in all of the interventions that you choose. Remember that reinforcement is any consequence, good or bad, that follows a behavior and makes the behavior more likely to occur in the future. So some tips for teaching the communication or the alternative response. We want to make communication easy for your child and set them up for success. Practice communication when the learner is motivated and calm. Focus your attention on modeling and teaching the appropriate behavior. You could start by fully prompting the learner through the communication response at the beginning of implementing the session and delivering the appropriate consequence, which could be access to a preferred item, for example. If they are engaged in escape maintain behavior to get away from non-preferred tasks or activities, you might embed preferences or preferred items into that task. For example, adding bubbles to the bath during bath time. So we also want to make sure to take baby steps when targeting a new skill, and especially a skill that we know is going to occasion challenging behavior. So for example, if your child hates to clean up their room and typically engages in challenging behavior, we might start out with just having them clean a small section at first and work up to cleaning the entire room. Sometimes your child may go 2 or 3 weeks having no trouble cleaning up the full room, and then have a particularly bad day when the task falls apart. If that happens, take a couple of steps back, lower your expectations or your demands so that they can be successful. You also want to make sure to reinforce immediately every time the child communicates appropriately, at least for the first couple of sessions. You can then start fading that reinforcement so that your child learns to maintain their appropriate behavior with just the reinforcement that is contacted from the natural environment. And remember that reinforcement is more effective, more motivating when you teach your child what you want them to do rather than when you focus on negative behaviors. So what might you do if your child does engage in a challenging behavior? Remember that challenging behavior presents a learning opportunity. And what you do will change whether your child engages that behavior in the future or not. So keep calm. During the behavior, you can continue to prompt neutrally the appropriate communication one time approximately every 30 seconds. Limit your facial expressions and try to keep your voice flat with no emotion. The behavior may intensify or increase before it goes down. Stay consistent and stay calm with your responses to their behavior. And finally, take data. Take data on what you see, how long the behavior lasts, what happened before the behavior, and what happened after the behavior. Give these notes and share this data with your BCBA-AD, as it will be essential to identifying how to improve the intervention and how to improve your child's responding. So now you are ready to meet with your BCBA-AD. Remember to identify an important challenging behavior that you would like to target for your child. You can discuss this choice with your BCBA-AD. Please take notes on how your child exhibits these behaviors and preferably submit a video. The video will allow the BCBA-AD to observe the behavior that you are concerned about and in particular get to know your child. We look forward to our first meeting with you, and we look forward to working with you. These next 2 slides have references that we use to create the materials in this PowerPoint.